In this video, I'm going to explain how to examine a patient's gait so that you extract the maximum possible clinical information from the examination. For this, I'm ably assisted by my colleague Sean. Hello, Sean.
Hello.
Do you mind if I examine your walking today?
No, of course.
The first step is to take a careful look at your patient and inspect them, usually while seated, because a part of testing walking is of course seeing if they can make the maneuver from sitting to standing comfortably and initiate walking. Some patients can walk but can't sit to stand, and that's also a consideration. But first we're going to inspect the patient. In particular, look for anything like a tremor that could be in keeping with Parkinson's disease, perhaps Parkinson's type features, and any muscle wasting that you might observe in their limbs. So Sean, do you mind just lifting your trouser legs up above your knee if you can, just so I can have a look at your muscles? And you carefully inspect the patient's legs to see if there's any wasting there, any operative scars or any orthotics. Also inspect around the patient, looking for any walking aids such as a stick or a frame. And of course, if you're going to test their walking and they use a walking aid, you should provide that. You don't want to cause your patient to fall. Thank you very much, Sean. I'm going to ask you to stand up if that's all right. We're now actually going to ask the patient to walk. If you feel confident the patient will be able to walk safely, you can stand back and do this. If there's any doubt at all that they could be at risk of falls, you should accompany the patient. Or if you're feeling brave in a clinical exam, you can ask the examiners to accompany the patients while you stand back and observe how the patient walks. Okay, thank you very much. If the patient manages to walk completely normally at first, we're going to try some other walking techniques just to see if any abnormality can be elicited. So in the first case, I'm going to ask Sean to walk directly with his heel to his toe as though he's walking on a tightrope. And if you can turn around, thank you. And then repeat that, thank you. Thank you. Again, no problem. Next, we're going to ask Sean to walk up and down on tiptoes. Thank you. And finally, we're going to ask Sean to walk up and down on his heels. Thank you very much, Sean. If the patient accomplishes all of these maneuvers without any difficulty, it's not likely you're going to find any abnormality in the gait. But the final component of assessing a patient's gait is to do a Rombergs test. This assesses a patient's sensory component of their balance. Most patients have three components that contribute to their standing balance: vision, proprioception, and their vestibular balance sense. Now, patients can manage to stand with 2 out of 3 of these sensors intact, but if one is missing, then their balance becomes typically impaired. So the way to do a Rombergs test is to ask the patient to stand with their eyes shut. If they have both normal proprioception and vestibular sense, then the patient should be able to maintain their balance with their eyes shut. However, if they become unstable or start swaying significantly, that implies either proprioception or their vestibular system is impaired, and they become what's called Rombergs positive. So Sean, I'm going to ask you to come and stand next to me. That's perfect. Now, ask your patient to keep their hands by their side and just close their eyes and just observe how the patient stands for 30 seconds, observing for any sway. A small amount of sway is completely acceptable because this in fact indicates that the proprioceptive system is doing what it ought to be doing, sensing a change in position and allowing the patient to remain upright. However, if the patient starts to stumble at this point, that does suggest a sensory-motor component of any balance problem. On the other hand, if the patient is ataxic, but they're able to undertake Rombergs test without any difficulty, that might imply there's more a cerebellar component to their ataxia. Sean here obviously has completely normal balance. Thank you, Sean. I hope this video has been useful in teaching you how to examine a patient's gait